Hi everyone, first was good. On the stream, we want to talk about different options or modalities that are available managed in the hospital that are taken to spiritual homes and other um, churches and so on, other areas that are not health inclined, they stand to lose. All right. So the topic for today has to do with exploring the different treatment modalities in psychiatry. So I believe that this is going to be an eye opener for persons that have persons with psychiatric or mental health related challenges, the type of treatment that your client will stand to benefit, where to take to, and so on, right? So on this discussion, you permit me so we could have direction on what we are discussing, the areas we are going to be touching, and so on. It will be necessary that I actually take down some notes that will guide the line of the discussion. So at some point, I'll need to peep through to ensure that we are still on track, right? So on this discussion, our areas of consideration or concentration will be divided into the overview of treatment modalities, of which we are going to have the various treatment options that clients in a rehab center or in the medical health facilities will stand to benefit from. And then we'll move on to the personalized treatment approach for which the hospitals or the rehab center they explore. And then we'll now move to the emerging trends and future direction for which mental health looks forward to or seeks to achieve, and the various call to action that we as individuals should actually look forward to. So permit me a moment to wake up sometime, be sure that the transmission is perfect. Please find where you're not getting me. Do well to put on my attention in the comment box. I'll be looking closely at the comment box just to ensure you are all following. So at any point you are not clear, please do well to call attention. Also, do well to like, share, subscribe if you are yet to, because more on psychiatry will be dropping as the days goes by. All right. So let's go to, by way of this, we're going to look at the various measures that we have earlier stated that are put in place in a rehab center, the different modalities, their application, and how they are being applied. We're going to look at the personalized care and the race. Let's do the overview of treatment modalities in a rehab center or the mental health facilities. Well, one of the major area that is the pillar of psychiatry or pillar of the treatment options for which the rehab center they put in place, which has to do with pharmacotherapy or you call it chemotherapy. This has to do with the use of mediums in the rehab center. The spiritual homes, a couple of them depends on different spiritual exercises, whereas in the rehab center, these clients are also given medications, right? So what are we saying in essence? If your client is taken to the rehab center, medications that would have to explore areas that concern with mood issues or behavioral issues will be given to the client. Those that have to do with memory will be given to the client. Those that have to do with cognition of the client, to develop the cognitive level, to develop the thinking capacity, the thoughts of this individual, to manage the speech of this individual will be given to the client. Whereas in spiritual centers, not a good number of them option. All right. Now we'll move to the other treatment approach that are also put in place in the rehab center. We have psychotherapy. This has to do with talk therapy. That's another what you could call it, talk therapy, right? Under this aspect, you have things such as cognitive behavioral therapy, where they are trying to repair the cognitive capability or abilities of this client to be able to see things the way they should be and not how they were seeing it before admission, but seeing things the way they should be in terms of reality. And then we have other options such as psychodynamic therapy and interpersonal therapy. This one will see what we call catharsis, right? Looking back to the past, what exactly must have been responsible in the past for this current episode. So some persons, it may have to do with how their upbringing was. That is a reflection of their personality. Some may even consider the personality of this individual being the cause of this client's challenges. Some the family dynamics. There are some that the reason for their admission is because, or the reason for their mental health challenge is because of a broken home or family that the parents are separated. So all these things will be explored. For those say they lost their loved ones, it will be explored and then put into consideration to manage this client and see how to talk them out of either their depressive mood or the challenge they are facing. Then we also have the another function where this psychotherapy plays. It helps individuals develop coping strategies. It reframes negative thought patterns and improves of this client. That's the advantage of psychotherapy. The next treatment modality have to do with psychosocial interventions, right? In this psychosocial intervention, another word or another name for it is called activity therapy. Another name for it is called diversional therapy. You can either call it diversional therapy, you can also call it activity therapy. You can also call it, I have mentioned diversional therapy or psychosocial therapies. These are therapies that looks into the social aspect of this individual. Okay, so these modalities focus on social support, education, and skills training. Example could include family therapy, group therapy, and social skills training. Now, for the aspect of family therapy, most of these mental health challenges can constrain the relationship of this individual. So the focus is that if the client was from a broken home, they could see how to, if there could be a mediation, or if there's challenge in the relationship of this client, maybe he was supposed to be married, say for instance, and then was disappointed, they could see how there could be a mediation. And then when the family are always being aggressive to the client, they are not giving the client attention, there could be consideration as to talking to the family or the person responsible that is exerting this negative influence on the client, for there to be a reduction, and then for the need for empathy will be emphasized. That's the aspect of family therapy. They will point out to the various family members their role in the life of this client and how it's impacting or affecting them. Another thing we'll talk about there has to do with group therapy, where the clients will be brought in group, they'll be paired in group. Then each of them will share their experience and they'll suggest possible solutions on how they thrived despite the negative influences that were around them. All right, well, we have things like alcohol, anonymous, we have nicotine, anonymous, and so on. All these will be explored by this client, all right, under the psychosocial interventions. Then we also have others that are based on skill development. Now, I will mention a couple of them. Under here, we have therapy, where the client will learn various things such as design, where you have most persons after rehab go into full-time fashion design, and they will open better businesses and they thrive better. They will do better after their rehabilitation. They have their businesses where they could have source of income from it. And then some people will be trained in skills such as welding, some will be trained in skills such as photography, sewing, and so on. A lot of options are there for them to explore. Some will be, for instance, we have the art therapy, where they will learn the various acts, and then they can make money out of it. And at the same time, it could serve as a diversional therapy. These are options that they benefit in a rehab center compared to the spiritual homes, compared to other, maybe the churches and so on. All right. Now, the next area under this psychosocial therapy have to do with recreational therapy. In this one, the various forms of exercise will be explored, such as yoga, football, swimming, depending on how the facilities are made available. So the clients will go out for sport, exercise, running, and so on, just to help them divert their attention from boredom. All right. So the next option here is the dance or music therapy, which is also explored. So this at the other end could be used for assessment of these clients if there is better coordination. So different musics can be brought in and they'll be assessing the client if it's dancing off tune or singing off key. All those things will be explored. And at the same time, it's a diversional therapy. And then most clients could even learn these musical skills. And then some could even discover them. All right. So these are some of the things that they stand to benefit in a rehab center, whereas in spiritual homes, they will not get this benefit. Ah, my sister, thank you so much for having me here. It's been a long time, and we are here on our discussion again on psychiatry. Thank you so much. Happy Sunday. I trust you are good. How's the family now and everyone? All right, so as we're saying, we also have the dance and music therapy. The clients, they will have a section where they are all brought together. Music will be played. They'll watch them dancing. They'll watch them singing, just to ensure to see if they are actually coordinating, if they are returning. Some people could be dancing off key, totally off key. Some could be singing, and then all these things, the carer or the therapist will be observing the client. They'll be observing the client. Yes, so longest time, longest time. Thank you so much for having me here. Longest time. We're back now on our YT journey. It's been a long vacation. Okay, so as we're saying, we also have the parole. Now, this parole is where the client is given certain privileges to go out of the facility and then to check how the client could be able, if the client can be able to adjust back to the society. This is mostly done when the client is stable and close to discharge. So the client could be allowed to go to the market to see if he can be able to make budget, right? Could be able to make budget and then to buy things in to stay within the budget. Some persons are naturally extravagant in nature. So this parole will give the privilege to check if they are able to manage their money very well. Thank you so much. Thank you so much for the emoji. Thank you so much, my sister. So some clients will be given the privilege to explore, to see if they can actually be able to manage their money very well, their resources, so that upon discharge, if they were having issues with money management, that will be addressed. Also, some they could be given privilege to go to the house. Sometimes they'll start with, first of all, some hours, and then 24 hours, and then 2 days, 1 week, 2 weeks, and so on, before they'll now give them official discharge, just to see if they can incorporate or be adjusted back into the family setting, and then to see if they can function well after discharge, and to explore if after discharge they can use their, if they will use their medication or not. There are those persons that only use medication while they are in the facility. So the essence of parole is to check if the client can independently use these medications after parole. So these are some of the options that we explore in a rehab center or a medical health facility, which are not explored in the spiritual homes. That is for diversional therapy. And in addition to this, there's what we call spiritual therapy, where they will be brought together for prayer section, fellowships, and so on, depending on their religion. All right. So all this I explored. In fact, in recent time, medicine has moved on to considering the spiritual aspect of man. All right. And this, we know a client could be unstable and so on, disorganized, but once you allow him, given this privilege of spiritual care, you see that they are calmer. Thank you so much, my sister. Thank you so much. So they are calmer. You could see that most of them would know that, yes, they are not totally left alone, that God is actually concerned in their life. And in life, it's not like a smooth ride, that things are bound to happen. But that does not mean that God does not care about you. It doesn't mean that everything is end for you. In life, there are periods of down, there are periods of up. So those are some of the things that will be explored during the spiritual care. And then they'll see how to, at the same time, talk the client, if it was depression, out of the depression, to see that God actually cares about them. These are things that are benefited in a rehab center under the psychosocial or diversional. I say the last name for it is called activity, right? So after that, we now have the next one, which is called the modulation therapies. This one now, in this neuromodulation, thank you so much, my sister. Yes, it's actually true. So under this neuromodulation therapy or techniques, it has to do with the exploration or the application of surgical interventions, right? Surgical interventions. You have interventions such as transcranial magnetic stimulation, called TMS in short. We have electroconvulsive therapy, where some level of shocks are applied to the client. So severe depression could be an instance where this electroconvulsive therapy is applied. And then schizophrenia, don't worry, along our course of these discussions, we are going to get enlightenment as to the different conditions, their names, and what they actually mean. For instance, I just mentioned schizophrenia, for instance, right? In one of those video or sections, we are going to talk about them. So that when you see, you know that this patient is suffering from schizophrenia, is suffering from depression, and so on. In a normal life, people have points of down moments, points of that low, but where it stays longer, and then the individual lost total interest in performing activities they once loved. For food, some people eat over. There are people that in their depressive phase, they eat more than how they used to eat. What do you expect? They will now have more weight gain. Whereas some people do not even have the appetite to eat. You now see them having loss of weight. Some people do not have the zest for life. You start seeing them contemplating to take their life. All right? So you now have some persons, they will contemplate suicide, which I've mentioned. So that shows you that this is a depression. This is a depression. While some, you have them very hyperactive. They are very proud in nature. They talk, they look very wise. They can even say things. I say, this one is very intelligent. It shows you that this is a manic client. But when the client is totally disorganized, he doesn't have too much of these hyperactive phases or the lower phases. It's pointing you towards schizophrenia, right? But it takes time for you to move from this diagnosis to diagnose a client of schizophrenia. Don't worry, as we move on, you are going to get the different types of condition, and you're going to know that most conditions will rush to a medical health facility. We're supposed to be managed in a rehab center or a psychiatric center, such as epilepsy. We have stress in its the end stage of stress called burnout syndrome. In burnout, where you are in a toxic environment, you are working under a toxic environment, you are in a toxic compound, a toxic relationship, and so on. And then you are accumulating this mental stress. You keep on accumulating them over time. You don't air them out. You bottle up. This stress will lead to what we call burnout, or you are working overtime just to make up more money. Do you know that it is not actually working a lot of jobs, getting a lot of jobs that actually gives more money, whereas it's actually working smart. There's one job you can have and you dedicate your time and effort. Thank you so much, my sister. Thank you so much. You dedicate all your time, your effort, and you diversify in it. It will give you more money compared to getting 5 to 6 different jobs where you don't even have time for yourself. There's what we call self-care. You're supposed to give yourself that time and attention to love yourself, right? So when you continuously stress yourself out in these multiple jobs, it could lead to what we call burnout syndrome. The extreme of stress, the chronic form, is called burnout syndrome. And the right place to manage it is in a rehab center, not just any medical health facility, right? So these are some of the things that will be benefiting from in all these sections, right? Now that will take us to um, okay, well, we're currently on the neuromodulation therapy where I mentioned electroconvulsive therapy. That a chronic form of most illnesses, you use electroconvulsive therapy, which I mentioned, such as chronic depression and the rest, schizophrenia and so on. Where the client is not responding well to medications, they can explore this electroconvulsive therapy. And then we have the vagus nerve stimulations, which are also used, and then are used to modulate brain activity and alleviate treatment resistant symptoms. All right. Thank you so much. Thank you so much, Blessing. Thank you so much for having me here. I'm so grateful. Thank you so much. And then we have alternative and complementary therapy. Now, this is a sensitive area. Most persons think that once they take you to a rehab center, immediately they will start administering antipsychotics. No, it's not true. It's not true. Not all clients are managed on the same medication. There are clients that throughout the beginning to the end of their stay, all they are taking is just thiamine or vitamin C. And vitamin C, every normal person out there takes thiamine. They also take vitamin C. What is thiamine? Thiamine is a vitamin B complex. The vitamin B has about 12 to 24 different classes, right? So one of it is vitamin B1. Vitamin B1. Now, this is mostly given to clients that have issue with appetite or alcohol-related issues. So most of these clients could be managed with just that timing from beginning of the admission to the end without introducing any antipsychotic. So what are we saying in this alternative therapy? That most of in this particular therapy, supplements could be incorporated in the rehab center. You could use supplement too, not just the antipsychotics. So mindfulness, this therapy has to do with mindfulness-based intervention, yoga, herbal supplement that can be used in conjunction with traditional treatment to promote relaxation, to reduce stress, and then enhance overall well-being of this client. All right. So these are the different forms of psychosocial therapies, or the different forms of alternative and complementary therapies, right? So let me make a recap on the treatment approaches or the treatment options available in a rehab center. I started by mentioning the first one, the pharmacotherapy or the chemotherapy, which has to do with the use of medication. And then we move on to the psychotherapy, which have to do with talk therapies, trying to look for issues that were there in the past that are responsible for the challenge, the psychological challenge the client is facing today, and then rendering solutions or remedy to them. Move on to there from that to psychosocial interventions, where we have mentioned things such as occupational therapy, we mention things such as music or dance therapy, we mention recreational therapy, we mention parole and the rest. All right, this one looks at the social aspect of this individual, because the client, there's services that are offered to clients, they're actually individualized, and at the same time they are actually holistic. We are going to look at that, the philosophy of rehabilitation. When we talk about that, we're going to look at how clients are being managed in a rehab center in terms of their religion, their beliefs, and so on. We don't just manage all clients using the same approach. There are different philosophy we explore. But in this one, we're only talking about the different treatment options that are available in a rehab center or mental health facility, which you will not get in prayer houses or spiritual homes. And then we'll move on to neuromodulation therapies, which are the use or introduction of surgical interventions in the management of psychological related uh, uh, treatment. And then move on to alternative and complementary therapies, which are the use of the various supplement, mindful-based intervention, yoga and herbal supplements alongside our antipsychotics. From here, we'll move on to another area which we call personalized treatment approach. Under personalized treatment approach, the first one to consider is individualized treatment plans. Remember, I talked about the pattern for which we use in treating our clients. It is individualized, right? Now, this has to do with tailoring treatment to each person's unique needs, their circumstances, and preferences. This simply means that your story is not my story, your background is not mine, your environment is not mine. And so, therefore, because we are not all coming from the same background, the same type of occupation, the same type, we don't have the same type of history, we didn't have the same type of upbringing, our treatment approaches are strictly dependent on our upbringing, the type of family structure, how we grew, and all those things are put into consideration. So, individualized treatment plan is what is used in psychiatry or mental health care facilities. The next one is multidisciplinary team approach. In this one, it has to do with the holistic management of this client, where various clinicians, various therapies come together to manage this client. It's a collaboration between psychiatrists, psychologists, social workers, and other healthcare professionals that ensure comprehensive care. So the nurses are there, the psychiatrists are there, the psychologists are there, the social workers are there, the nutritionists, sorry, they are there, and then the occupational therapists, they are there. All of them bring in their own quota for the overall management of this client. And we now have the cultural competence, which has to do with recognizing and respecting the cultural backgrounds of this client. The values of these clients are respected and beliefs of individuals and families. On this very aspect I talked about, the personalized treatment approach, a broader view will be given in a different section. I'm only summarizing them here, all right? So that takes us to the emerging trends and future directions in psychiatry. Remember, in our previous live stream, we talked about what psychiatry looks like in the past. And then in this very one, we're looking at what psychiatry looks like currently and where psychiatry is looking forward to. One, the first one, digital mental health, which leverage on technology to increase access to care, to improve engagement and enhance outcome. Gone are those days where the client needs to move distance and miles just to seek for rehabilitational services or psychiatric or psychological interventions. Now we have real-time services where the clients could use their cell phones and the use of social medias. It could be Zoom meeting, could be through Zoom meeting, could be through WhatsApp call, to be through different forms where you talk and you see your client virtually. And then services such as talk therapies are render recommendations. When you have concern with your medication, adjustment can be made, new prescriptions can also be made. So those are the current trend in mental health services. The next one has to do with precision in psychiatry, which involves the use of genetic testing, neuroimaging, and other biomarkers to personalize treatment and predict response. Gone are those days where you just see clients and then you bore the hole just to see how those spirits escape. Or when the client just come in and you just suspect one thing and you start treating. These days, there is increase in precision in treatment of this client. Remember, I talked about some medical health challenges uh, that could express in form of psychological challenges. For instance, HIV and AIDS, the terminal phase, cancer, the terminal phase could express themselves in mental breakdown. So when they do lab or laboratory investigations, it will tell that this particular psychological breakdown is as a result of the medical challenge that the client is having or the medical condition that the client is suffering from. The next one have to do with the use of imaging. X-rays could be done on the brain just to check if the chemistry of the brain, if the imaging of the brain, they are intact. And then biomarkers could also be used in different forms. And then the third one have to do with integrated care, where there is combination of mental health services with primary care to address the whole person, which has to do with the body of the individual and the mind. Services are not just targeted at the mind alone, but the body also, the physical body of the physical aspect of the individual is considered, where the hygiene of the client is put into consideration, his activities are put into consideration, his physical outlook, what type of exercise can he go into, then the mind, which has to do with what type of job could his mental state be effective to manage or to withstand. All those things are put into consideration. By way of conclusion, it is important to let us know that treatment modalities in psychiatry are diverse and constantly evolving, they're constantly changing. By understanding the various options available and adopting a personalized approach, we can provide effective care and improve the lives of individuals and families affected by mental health conditions. It's interesting to know that if our government, our NGO, non-governmental organization, and philanthropists invest their monies, invest in the building of structures of rehab centers and the purchase of equipment to ensure that psychiatry are given the optimal services, the rate of response, the outcome will be better off compared to where we are. And it is essential to let us know that all of this can not just take place only on in rehab homes. For those who have strong belief in they have strong belief in the various churches and so on. Some of these churches have advanced to using of clinicians in their churches to serve the medical. They have medical teams or associations in the churches that they refer the clients to. So going beyond that, they could have some of these facilities that could render like a first aid or attention to psychiatric emergencies, such as alcohol intoxications, such as attempted suicide, and the rest, such as delirious state, which is excessive or chronic confusional state. Some of these facilities or equipment could be given to these churches, and then they could handle those emergencies before referral. All right. So some of these services can be rendered in educational establishment, community centers, hospitals, clinic homes, individual and commercial organizations, prisons, schools, charity and voluntary services, primary care, residential and nursing homes, and then special service and counseling department, housing associations. They could get some of these facilities and they could also explore the special hands they have within them. And with this, you could see there could be better outcome. But just to give a clear distinction is that taking your clients to a rehab center, a mental health facility, is better off than spiritual homes, because in most rehab centers they have advanced to get all these advanced technologies that could comprehensively and holistically manage the clients compared to spiritual homes. And by way of waking up, or like a wake up call, a call to action, we could encourage individuals to seek professional help and support at our own various capacities. And then we could promote education and awareness about mental health treatment options. They could have sections for counseling, sections where they educate, that's the medical professionals could come in to educate their members on the various treatment options for mental health challenges. And then there could be room for fostering collaboration among health professionals to provide comprehensive care. Thank you for joining me today in this amazing discussion. I believe you have learned a lot. Let me know what you have take home, or what is your take home in the comment box. Just let me know what you'll be able to benefit. And then I hope this talk has provided valuable insight into the world of treatment and treatment modalities in psychiatry. I want to appreciate everyone that stayed to this point. If you are yet to subscribe, please do well to subscribe. If you are yet to give this live stream a thumbs up, please click the like button to give the video a thumbs up. And I'm looking forward to see you on subsequent discussions, and also to check out other videos as concern this topic. You can go to my channel and then check under the playlist. You see the health angle. There you see other psychiatric or health related content, and then my other channel, which is Wisdom Akbar. You can check it up, and then you see under the playlist for health or the mental health, you could see similar contents like this, which you can also benefit from. I believe that doing so, you have more to benefit from channel like this. All right. Thank you so much, and I look forward to seeing you coming around and making this channel your most favorite clip. For now, stay blessed and see you subsequently.